Good afternoon, everybody. Good afternoon. Welcome again to our Coffee and Conversation Hour. And we are back. We are back live. I am Craig. And yes, give me a minute. I'm trying to get everything synced in. Right. This is our Coffee and Conversation Support Group meeting. And so, without further ado, tell a friend, let them know what we're doing here at Capital Recovery Center. We love to have you a part of what we're doing here at Capital Recovery Center. All right. And so today we're going to be talking about addiction. Yes, we're definitely going to be talking about addiction, not addiction, addiction. All right. And we're going to bring you an article today by recovery.org. They have some good information over there. And so let me just post it on the screen so that you'll see exactly what we're going to be talking about. And that is addiction cravings, symptoms, treatment, and relapse prevention. This is our Coffee Conversation Support Group. And so, as I mentioned, my name is Craig. I am a recovery coach. So let's get right into it without further delay. The article starts out by saying, experiencing craving is a normal part of addiction recovery process. Let me read that again. Experiencing cravings is a normal part of the addiction recovery process. According to the National Institute on Drug Abuse, NIDA, more than 85% of people in recovery relapse in the first year. That's a high number. A common reason for relapse is due to cravings, which are often response cues formerly associated with drug taking experiences. If you or someone you care about is misusing substances or has already started the recovery process, it's helpful to learn more about cravings and how to more effectively manage them. All right? And so some of the cravings are things that one should look out for. And the article says, it asks the question, it says, what is craving? How long do craving last? What are triggers and drug cravings? What are common alcohol and drug cravings? What is relapse prevention? How can you manage drug cravings? And what medications are used for cravings? Good questions. Good question. So the next topic we want to talk about, and that is, what are alcohol and drug cravings? Okay? And that is, the article says, drug or alcohol cravings are intense desires to use drugs or alcohol, which trigger an urge or intent to use alcohol or drugs. Cravings can be so strong that it's difficult for a person to focus on or think about anything else but satisfying the urge to use the substance. Cravings are a symptom of substance use disorders as outlined by the American Psychiatric Association, APA, Diagnostic and Statistical Manual of Mental Disorder, DSM-5, criteria for substance use disorder such. The APA explains that cravings can occur at any time, but they're more likely to occur if you are in an environment where you used to use or obtain the substance. Cravings can be difficult to withstand for people who have a substance use disorder, partly due to the way many addictive substances work in the reward center of the brain. Dopamine is one of the neurotransmitters in the brain associated with reward, motivation, and reinforcement, and repeating pleasurable activities. It is naturally released in response to pleasurable activities. like eating or sexual activity. When a person takes drugs or alcohol, the brain's reward circuit is activated, resulting in abnormal large amounts of dopamine. This release helps to reinforce the desire to use the substance. Over time, this release, when using a substance, will cement the connection between the substance and external cues or triggers related to using. Cues can be things like the environment you use to use drugs and people you use substance with, drug paraphernalia, or certain physical sensations. These are cues, right? When a person stops using a substance and goes into a withdrawal phase, they can experience craving symptoms. After the body has adapted to the presence of the drug or alcohol, it may be difficult for a person to experience feelings of pleasure from anything else. Many people may relapse because the desire to experience pleasure again and get relief for uncomfortable withdrawal symptoms is so great. Read that again because I think a lot of times we miss this point here. But the article made mention about the lack of pleasure or the adaptation to the pleasure sensory due to the overload of substance abuse, and which releases a large amount of dopamine through the neurotransmitter that this article makes mention of. It says many people may relapse because the desire to experience pleasure again and get relief from uncomfortable withdrawal symptoms is so great. So that's one of the reasons why people may withdraw, because the article may mention that it may be difficult for a person to experience feeling of pleasure from anything else once they have a or once the body has adapted to the presence of drug or alcohol. All right. So how long do cravings last? How long do cravings last? The article says the amount of time a person can experience drug cravings varies depending on several factors. Someone who has a substance use disorder may experience craving while using substances during withdrawal and after withdrawal and treatment. Okay, so it varies depending on several factors. It says someone who has a substance use disorder may experience craving while they are using the substances, also during withdrawal and after withdrawal and treatment. So it varies when the time frame or how long. The article goes on to say the APA, the American Psychological, excuse me, the American Psychiatric Association points out that cravings can occur at any time. All right. It says that people can experience craving even if they haven't used the substance in years. Treatment for substance use disorders typically includes an element of relapse prevention, where a person learns to identify and manage cravings and cues that precede cravings. Being able to identify some of the cravings that one may have from the cues that they are experiencing, whether it be the environment. Remember, we read it says some of the cues that one can develop these cravings or these sensations of using again is being around certain neighborhoods, certain environments, certain people. These type of things can be external environmental factors, all right, and they often leads to relapse. It says treatment for substance use disorders typically includes an element of relapse prevention, where a person learns to identify and manage cravings and cues that precede cravings. For some misuse substances, medication may be used to assist in reducing, minimizing, or eliminating cravings. And so you may say, what kind of medication that this article may be mentioned or that we are aware of? And so a lot of times, some people may have cravings or urges uh, that may be triggers, cues, stimuli, however you want to. They may be having these cravings that may be so strong that they may need medication. And medication could be from a professional provider that may prescribe medication how they see fit. There are several different types of medication that they use now, what they call it leveling people off the substance use disorder or the addiction. All right. So I'm not going to go into which one because I'll leave that to the professional, but they are ones that people use. Let's go on to another topic, and that is what triggers drug cravings? I'm glad you asked. Exposure to places, people, or things that are associated with using the substance or that reminds you of using the substance can trigger cravings. All right? I know you may have heard that term, people, places, and things. I know you may be tired of people, places, and things. Well, people, places, and things are relevant factors that one should consider uh, when they are in recovery, uh, while they're trying to work on getting healthy. Be mindful because these triggers uh, can cause one to crave substance use uh, disorders. So it says cues that trigger cravings and may threaten sobriety are often common in everyday situations, such as going to the neighborhood where you bought or used drugs or alcohol, seeing people selling drugs or alcohol, going to a bar, associating with people, friends who drink or use drugs, having just one sip of alcohol, smelling the substance, psychological stress, relationship problems, work problems, chronic pain or pain associated with medical issues, co-occurring psychiatric disorders, encountering objects associated with past drug use, seeing drug or alcohol use in the media. All right. And so these can be some cues that trigger cravings, the ones I just read off. Right. Let's go to the other one. And that is common drug and alcohol cravings. Being familiar with cravings and the cues that precede or triggers cravings can empower you to take action to prevent relapse. Craving drugs or alcohol can include the following: physical urges to use the substance, strong intrusive thoughts about the substance, a desire to use the substance so badly that you can't do or think about anything else, significant distress when you think about the substance, right? Craving for specific drugs. Cravings can occur if you are dependent on a substance and stop using it and can peak in intensity at certain points during the day or week. Specific drug cravings can vary by onset and duration. Cravings can occur with many substances, including, all right, craving relapse prevention. Addiction is a chronic long-term condition that requires lifelong management. While you likely will never eliminate cravings, you can take steps to recognize what triggers cravings and learn strategies to manage them and prevent relapse. Relapse prevention strategies can involve using skills that you learn during treatment or those that you continue developing as a part of a continual care plan. Continuing care may include mutual help groups like Alcoholic Anonymous or SMART recovery programs, therapy, or other services. Receiving proper treatment, which may include medication that help reduce or eliminate craving, as well as ongoing support and aftercare, can be a beneficial way to deal with cravings and remain clean and sober. All right? Now, this article is brought to us once again by recovery.org. And so, yes, recovery.org. You can retrieve this information. Uh, Feel free to go online and get it, read it, hold on to it, learn some coping skills, some strategies, and techniques to be able to identify some cravings that one may experience. As the article says, these things can happen during the day or during the week. All right. Let's talk about addiction treatment for drug and alcohol craving. One size doesn't fit all when it comes to addiction treatment. Individualized treatment is important for optimizing your chances of long-term recovery. It takes into account many of the concerns that can impact addiction and recovery, including your medical, psychological, social, vocational, and legal problems, as well as other factors such as your ethnicity, gender, age, and culture. Common treatment and support for addiction include detox, right? For many people, this can be the first step in the recovery process. It consists of a set of interventions designed to help you stop using the substance, stay safe and comfortable while your body undergoes withdrawal, and prepare you for further treatment. Inpatient or residential rehab. You live on site at a facility of the duration of treatment. You receive 24/7 care and support and participate in different treatments. Outpatient treatment. You live at home or travel to a treatment facility one or more times per week. Outpatient care can occur on varying levels of intensity. Dual diagnosis treatment addresses co-occurring psychiatric conditions like depression or anxiety. It's important because they can impact cravings in your overall recovery success. Support groups such as this, receiving mutual support from others who know what it is like to be in your shoes, can help you remain sober. All right? Recovery is an ongoing process that doesn't end once you complete formal treatment. Continuing care for drug and alcohol disorders can help you avoid relapse, maintain abstinence, and support long-term recovery. Continuing care may involve many different methods, such as participating in self-help groups such as Alcoholic Anonymous, AA, or Narcotic Anonymous, NA. Engaging in individual or group therapy, living in a supportive housing such as a sober living home. Engaging in self-care, such as exercise and mind, body, relaxation techniques. American Addiction Centers maintain a strong partnership with a large group of insurance companies uh, at their treatment facility. Okay, let's talk about something else, and that is medication for cravings. All right, so there's a list of medication for craving. People being treated for a substance use disorder can benefit from recognizing cravings and the cues that precede them. Behavior therapy is commonly used to help identify cravings, cues, and triggers. That's one of the programs that I had the opportunity to participate in, and that was a behavioral therapy. We call it therapeutic program, but it was basically geared toward addressing behaviors. And one of the things that I took from it is that what I just read is being able to identify cravings, cues, and triggers. That is so important when you're talking about behavioral therapy. Uh, is so powerful that once you get a hold to it, once I was able to, we was always taught in the therapeutic community, behavioral therapy, is that you always keep the focus on yourself and not on someone else. So when I began to identify my trigger cues and cravings, then I began to learn how to respond appropriately. All right. For some substance use disorders, medication can be used to help reduce cravings, which may help to remain abstinence. There are currently no FDA-approved medication to treat addiction to cannabis or stimulants like cocaine or methamphetamine. However, there are medications used to treat alcohol use disorder and opioid use disorder that can help reduce or prevent cravings. These medications include two of the three medications that are FDA approved to reduce cravings for those with alcohol use disorder are acamprosate, may have some anti-craving properties and is typically used to help a person who is already abstaining from alcohol remain abstinent. Naltrexone. Naltrexone may help reduce craving over time by blocking the pleasurable effects of alcohol. Disulfiram does not help to reduce cravings, but if you do relapse, it reduces unpleasant symptoms that may make you less likely to continue drinking. All right. It said the three medications FDA approved for opioid use disorders are each effective at decreasing cravings for opioids are buprenorphine or methadone. All right, can reduce cravings for opioids during withdrawal management, post detox during rehab, and as part of an aftercare plan. No, Naltrexone blocks the effects of opioids and can be used following withdrawal from opioids as part of a long-term care plan for managing opioid use disorders. And so we just made mention about medication treatment system. We talked about the medication that is used for alcohol. We just talked about the medications that are available, FDA approved for opioid use disorder. All right. And so lastly, we want to talk about support and therapy for cravings. Managing craving usually requires a multifaceted approach to help prevent relapse. Behavioral therapies, support groups, and other forms of treatment can help a person overcome cravings, reduce the risk of relapse, and help to deal with relapse if it should occur. All right. A few common therapies and forms of support that can help manage cravings include cognitive behavioral therapy, CBT. This can help place in groups. This can take place in groups or on an individual basis. CBT teaches you ways to manage cravings and develop healthier stress management and coping skills so you can avoid relapse. Contingency management, CM. This is a form of treatment based on positive reinforcement. You receive rewards of tangible goods in exchange for positive behavior so that you are motivated to remain abstinent. Mutual support groups. These groups can include 12-step groups like AA and NA or non-12-step groups like Smart Recovery. By receiving support from others who are also in recovery and learning strategies to deal with cravings, you may be able to maintain your resolve to avoid substances and overcome craving. Mindfulness-based relapse prevention, MBRP. Learning mindfulness skills can help you ride the wave of cravings and help you maintain a non-judgmental acceptance attitude throughout your recovery journey. Distraction strategies or therapies. such as music therapy or art therapy. Receiving music or art therapy in a group with others can serve as a helpful way to temporarily relieve cravings and manage addiction. Stress management techniques like yoga. Stress can play a role in cravings and relapse. So manage your stress. So managing your stress can be a helpful way to remain sober. Different methods work for everyone. But one study showed that yoga can be helpful for cravings and overcoming trigger to relapse. Although dealing with craving isn't easy, it is possible to recognize the cues that precede cravings and overcome relapse triggers. Addiction treatment can help you develop the skills you need to remain sober and manage cravings. All right? And so that's going to do it for this week. Our Coffee and Conversation Support group. If you know someone that is struggling, that needs help in these areas, when it comes to cravings, triggers, cues, or need help with treatment from a relapse, remember, it's not over. It's not the end of the road because you have relapsed. Um, just remember, there is help out there. Some people may need medication to overcome. Some people may need a supportive group. Some people may need CBR, CBT, cognitive behavioral therapy. Some people may need behavioral therapy all within itself. And so there is a host of information. There's a host of programs. There's a host of techniques and strategies. There's a host of people that's willing to help you if you're struggling with the idea or the sensation. You don't know how to go about handling it. Reach out to someone and make sure that you get the right professional help. Let me say that again. Make sure you get the right professional help because a lot of times people are struggling with dual diagnosis, co-occurrence, and mental health disorder associated with substance use disorder. All right. And so that's it for me. Until the next time, stay healthy, stay safe. Take care.